And also to complicate it more. So medicine, when you use a week, 2 weeks, and 3 weeks, 4 weeks, the medicine works less. We call it tachyphylaxis or tolerance. So you need to give more. My goodness. For example, with morphine, the patient will say, "Doctor, I did get better when you gave me first week, but now it's already about a month. The medicine doesn't work anymore. I'm still hurting and pain." Then you have to increase the medicine. So when you keep increasing, then the patient will get in trouble because you're giving more and more, there is more higher side effect. So then we call it addiction. It's addiction by alcohol, and cigarette is well known, but there are addictions by tranquilizers and painkillers and so many. So all those things will come to you, and how you make decisions by you only. See how complicated that is? How computer could figure out all these 10 different variations of particular patient. Yeah. Again, we need a good doctor like you, so study hard. Alright, so medications we use, and I think I'm maybe going fast, that's good, we'll finish early. I should tell you this one, I should not forget. Now, I'm expecting your homework to me. Now, there was one way you send it to Hayamdrimi, and it comes to me, but I just learned there's a limit of period you can send certain homework, so I guess there's no other way except using my email. So send me your homework by email, make a copies in different ways. Or you can bring it by paper. You can bring it to the office. Maybe that's easier because faster. But I mean, it's less complicated for sure. I'll get it. So next week will be the last lecture. I expect all homework. And after last lecture, there is 1 week space. Also, I expect that also homework. So I know it will be more tighter as time goes on, but that's the way of life. I told you, meet the challenge, the resilience, and then you get that done. You've done so much, so well, so far, and medical schools, you finish it, and after medical school, there'll be the time to relax and enjoy your fruits of labor. So that is the way. So I expect all your homework in when I give you final grade. That means the earlier the better, but I'm checking on, and therefore I would like to give you credit as your hard work, and also I want to be fair. I want to give A for the students who did good job, good homework, good research. I also give you less if a person did not respond, and we call it apathic, no response in psychology, and then I cannot give you a good grade. So good work will get good grade. Poor work will get poor grade. That's my assignment by the school to do fair work. So I'm trying to give you most credit as much as I can, because I want you to pass all my class. Every one of you here. I would feel so bad to fail any one of you. So join in, good work, happy endings. That's what I want. So when I go back home to Los Angeles, you can send me email, but I cannot correct you. Final grade. So get in touch and do your best. So again, even though I'm speaking to the empty seat, and I know you will listen, do a good job. So do your best. All right. So now go back to the medications we use in pharmacology. So this is what I had in my mind, comes in my mind when I look back, think back over my pharmacology textbook. So there are so many, but medicines comes with anti. Why comes with anti? Because pharmacists, doctors, trying to fight that abnormality, particular. So, fungus, we call it antifungal. Bacteria, we call it antibacterial. Virus, you name it, antivirus. Antibiotics means, we kill microorganisms. Antipyretics is a fever reducer. Comes with usually an analgesics, so analgesics and antipyretics comes together. Typical is Tylenol, acetaminophen. When you take medicine, fever goes down. When you have toothache, pain goes away. So you can take it, it works both ways. If you have a fever and toothache together, hey, take only one medicine. That'll do both jobs, you see. So knowing that medicines, what medicine does it, and you select best one, and you will be a good doctor. That's it. Okay, third one is antihistamine. You know antihistamines, the allergy medicine, because histamine comes out of the mast cell, basophils, and then it is released out of the cell into your system, and then you feel what? Itchy, sneezes, red, rubbing, hives, all those things show up. So, what to do? You take antihistamines, and then antihistamine will decrease the action of histamines. Therefore, you feel less itchy, less sneezing, less rubbing. Hey, that's wonderful, isn't it? However, many antihistamines may make you sleepy. That's the reason you have to be careful when you drive. Sometimes oversleeps. So, have to be careful. There are side effects and real good effects. Analgesics, antipyretics comes together, I told you. Anti-inflammatory, usually steroid medicine. There is also NSAID medicine, anti-inflammatories. Anti-diabetics, well, there's insulin antibiotics, but there are other pills made for the diabetes, you name it, or 6 or 7 kinds of medicine that comes in again. When I was in medical school, I had mainly medicines by mouth for diabetes, maybe 3 kinds. That was it. But now, when you look at the book, about 10 kinds comes in different names and different prices, and every drug company tried to make it new because they make money out of it, and they tell them that's the best medicine in the world. So you need to kind of understand the pharmaceutical company. The drug salesman tells you, doctor, this is the medicine is really good for the diabetes and so forth. But you listen to them, but you need to make decisions. What's good for the patient? What's the price of this medicine? Double price of the medicine. And then, is it worth it to pay $100 a pill compared to $1? If it's about the same, you don't want to spend your patient money. That's not good. So smart doctors will write good prescription for the patient. But patient says, doctor, I don't mind paying $100 if it's this much good, but I have lots of money. Fine. That's up to you. But most of them, you smart doctors, will consider the price of the drugs. And diuretics, that means going to the bathroom a lot to urinate. Cardiotonics, good example is digitalis. Bronchodilators, I told you, albuterol. So these are the not real name of the medicine, but these are the classification of the medicines. You see, again, classification. That's very important. So you know, oh, this medicine belongs to antihistamine. Hey, that's it pretty much. So now next, anesthetics, that's pain, numbing medicine. There's a local and general. When you become an anesthetist, you're going to use it every day, these medicines. But if you're not, you don't use it general anesthetics, everyday practice. At the most, you use local anesthetics to numb the part of the body by putting the needle into it nearby. Good example is xylocaine, lidocaine, procaines, and these are the kind of numbing that area. And last, chemotherapeutics. It's a funny, but actually is a cancer medicine. You use many different kind of cancer chemotherapy, and combination of it. Each medicine has a side effect. Some of them is hair falling, some of them stomach ache, diarrhea, rashes, you name it. So that's a very difficult part of oncology. I don't use chemotherapeutics in my practice because I don't have a patient, first of all. And the medicines are very unique and comes in different ways, different side effects, and many oncologists uses it. So that's kind of rundown of medications I had. And then here, 첫 단추, medical terms. So I want to go on this textbook, chapter 18, starting page 620. So the timing wise, oh boy, I have only 5 minutes, you see. So these are the terms you are going to memorize. Yeah. Unfortunately, medicine involves lots of memorizations. Just try to remember. However, there are 2 ways to remember. One way is just comes in your brain and eyes, and you just, like a typewriting, and keep memorizing. That's probably not the best way. You feel tired, you get confused. But the better way to memorize is by classification. Antibiotics, antipyretics, sedatives, diuretics, antihypertensive. So by using that classification, you memorize that particular names particularly belong to the classification. So that's how science makes study easy. I don't mean classification is best, only way, but it's sort of easy way. But also I will tell you, classification sometimes makes you confused because it was wrong classification in the long time ago, and new classification came upon, like the name of the bacteria. But anyhow, let's go on. So each chapter has, in page 620, has sort of basic meanings of it. Iatrogenic, hypnosis, histology, pharmacology, pleuretus, and pyretic, and so forth. Toxicologies, and so those are the terms that if you know, then it's easier to understand. All right, let's go on page 621, next 5 minutes. And I have given you pretty much, but this is the right time. The medication has more than one name. How come? Even you can call 3 names. Boy, even one is hard to memorize. How come each medicine has 3 different names? It's impossible, but that's the way of medicine goes. First of all, when they develop the medicine, it's a chemistry. So the chemical name. Chemical name is long and complicated. Yeah. The acetaminophen, acetylsalicylic acid, and so forth. So the chemical names is accurate, even though it's hard to remember. Some people, some doctors, some textbook recognize chemical name, try to use chemical names as often as they can because it's accurate. And there's no bias and no commercial influence on it. So that's chemical names. And generic names. Generic names is sort of the name, for instance, ampicillin is the generic names. But some companies said, we don't call it my product ampicillin is ampicillin. We're unique. They said Amcil, Omnipen, Pembrolizine, Polycillin. See, it makes things are so complicated for you. So again, 3 kind of names for each medicine. Some of them has only 2. So memorizing all those names are so complicated. And then for my medical students, Korean medical students have to do the same thing, again with Korean names. So that really makes double. Anyhow, so try to remember the chemical name or generic name. Try to avoid commercial names because it has a bias, it has commercial influence on it, and each company tries to sell their names to you, and each company says they are cheaper, but no commercial, no merchants will tell you the truth of the price. So that's the merchant. You're the doctor, you're not a merchant. You're not a drug seller. So don't believe everyone they say. Okay. And I think I'm close to the end. I have 2 more minutes. So when you look at it here, the book has different color. So blue color is more important. Black one is less important. And here is green one. It's a sort of classifications. So anticoagulants, antidepressant, cardiotonic, I told you, anti-arrhythmic, that's also complicated names of it. Antihypertensive, anti-diarrheal, anti-emetic, you remember, 항구토제, anti-emetic, so anti-malarials and tetracycline. So at the end, you also, this end of the book, 627, it has abbreviation. Now, medical names are long and complicated, some of them Latin and so forth. So you can see lots of abbreviation. So FDAs, GIM, already GTTs, and these are the abbreviation you use in the prescriptions. All right, so that's the end of the book. and I will do one more lecture. That's the last. If you have any question, send me an email. Any emails are welcome, and I'll try to answer as fast as I can, hopefully same day, and I will have next one more lecture, and that's the end of good work of awesome technique. Alright, so study hard, have fun,